Someone had emailed me about whether I am comfortable with taking care of SIBO and the suggestions for it. So that stands for small intestinal bacterial overgrowth. And it's in the last, say, 5 to 10 years, it's been worked up. There's actually, you find a lot of information on the internet about this, and I think it's the symptoms of anybody that suffers from irritable bowel syndrome, whether it's constipation dominant or diarrhea dominant, and leaky gut and all the malabsorption and vitamin deficiencies associated with that. There are treatment plans that you'll come up with, or that you'll see on the internet, where you can actually get a stool transplant. You take stool from somebody, believe it or not, that has good bacteria in their gut, and you put that in somebody else who has poor bacteria or an overgrowth of the bad bacteria. This is usually from years and years of either antibiotic use or irritable, or I should say dysfunctional digestion. So the basic premise would be, as a physician, to rule out any big disease. If the GI specialists did all their scoping, did the blood testing, did CT scans to look for pancreatic masses or other dysfunction in the gut, then great. It's easy to take care of SIBO. You just have to, or leaky gut syndrome or irritable bowel, you just have to kind of follow the drugs that have been used before and cool down the attacks when they occur and have the patient try to lead a healthy life. But that's the shortcut. Anybody can do that. The beauty of integrative medicine is once, whether it's the controlled symptoms or still out of control, once the patient comes into the office, it's our duty to figure out the best healing practice that would fit the patient. So I would always say, even if the best GI specialists have been seen, I would embrace other possibilities. There's Ayurveda, there's homeopathy, there's medical acupuncture that can always be taken advantage of. I think mind-body medicine also is an underutilized source of healing or decreasing the suffering. So that, in addition to making sure of the basics of digestion, watching and seeing how we maintain food intake, not spending gobs of money on organic, because you can get away from the pesticides of certain foods depending on what I like to see what the EWG has to offer as far as information on the newest tests in the US, but also making sure that the supplements used aren't too extravagant. I think you can get by with some basic probiotics to try to get the gut to heal, some prebiotics that don't flare up an irritable bowel diarrhea dominant or constipation dominant episode. Again, there's other digestive enzymes to use. There's timing that has to be made aware of to the patient. Sleep has to be maintained. So I think all those parameters have to be taken into account. It's not just does anybody practice or comfortable with it, but thinking outside the box would be the best way to say staging the return to wholeness. My usual reaction to anybody that comes in with disease is, how do I get this person back to where they were feeling pretty decent, like childhood? And if the body is really messed up, has been dependent on a lot of prescription medicines, or is totally stressed out, then it would be really difficult to change a 360 all at once. So sometimes if the physician or the integrative medicine person can be the architect for staged small changes, say every 3 months, and then leapfrogging from that plateau to the next change, that hopefully will get you to the point of wholeness without making major changes and asking for a flare-up to occur. So hopefully this helps.